One thing which we can do as to simplify what we have as the concave convex rule or the convex concave rules. Actually, that double name is not there. The rule is only concave convex rule. That's all. When we have this convex bone and this is concave bone, if I keep my 4 fingers or 3 fingers here and 3 fingers here, okay, so it is like I keep 3 fingers along the convex bone and I keep the 3 fingers along the concave bone. Okay, I've kept the 3 fingers because just for a understanding. If the contact area is the same, finger touching the finger, it does not change, and then the movement happens, rolling. Contact area changes. Contact area changes. That is gliding. Okay, so the middle finger, which is at the middle, will become, it will come to the ring finger. Or the middle finger here will become the index finger. It will come in contact. The contact area changes during glides. So that is the reason a normal flexion extension will be painful for the patient because same contact area. The articular cartilage or the subchondral bone, which is painful. Same contact area. So movement will create the pain. And then we give the glide, the contact area changes. And we give the distraction, the synovial fluid comes for the cartilage. Intermittently we give oscillatory mobilizations. So nutrition happens to the joint. Also another thing which you see with these movements, this bone, this is my right hand, this is my left hand. Like this. So what has happened? The bone has moved towards my right. But how the glide has happened? Towards the left. Bone has moved to my right, whereas glide has happened towards my left. So it's opposite when the concave bone is moving. The convex, okay, pardon me, okay. Concave bone, right side it has moved. Here nothing happened. Bone also has moved towards the right side and the glide also has happened towards the right side. So same direction movement happens in the concave bone between glide and the roll. So every time when a movement happens, if there is a flexion, that means rolling happens towards the flexion, which is a posterior direction. So we tell it as posterior rolling, anterior gliding. If I restrict the anterior glide, flexion will not happen. If I allow the anterior glide only with the rolling in the convex bone, the flexion will happen. This is, for example, femur. So femur posterior rolling and anterior glide will increase the knee flexion. Tibia, if you see the concave bone, I want the knee flexion. This is femur flexion. This is tibia flexion. So that means I need to give a posterior glide. Definitely flexion will improve in the posterior direction. So that is open kinematic if we are giving focusing on the tibia. If we are giving focusing on the femur, it becomes the closed kinematic chain. Also, people will have fracture of tibia. You want to mobilize the knee, use the femur. Through femur, you can get the range. For example, surgical neck of humerus fracture. You cannot give the shoulder mobilization. Instead, mobilize the scapula. So you can include this concave convex rule in multiple scenarios. Mainly, it is for examination. Okay. When it is for treatments, it is purely for articular dysfunctions. Concave convex rule does not take care of what the muscles are doing. It is only the capsule, it is only that the cartilage, ligaments, all that. So this is one important part of arthrokinematics to ensure that the glide and the roll, how it determines the movement restriction or recovery, whether it is open or closed kinematics. So this is something which can be easily simplified by the thermocol, okay, which I always highlight or insist that you make it in the chart, or you make it like the packing box is coming, cut that and keep it like this in the hand so that the perspective becomes three-dimensional. Okay, right?